The strategic goal I want to implement is to develop a comprehensive collaborative approach in our facility to pressure ulcer prevention that will focus on pressure injury awareness and education for the nursing staff. So the mission of Piedmont Healthcare is to make a positive difference in every life we touch. This goal will certainly align with our mission by enhancing our ability to keep our patients safe. So Piedmont Healthcare is working towards a goal of 0 hospital-acquired conditions, and this will certainly align us with that goal. The key stakeholders we want to focus on during this process would be the frontline nursing staff, and that would include the RNs, the LPNs, as well as the patient care techs, the patient transporters, radiology staff, laboratory department staff, etc. The clinical managers, the quality improvement director, the wound care team, our patients and their families, the unit-based educators, the finance team, the chief nursing officer, and the education director. Various channels of communication are going to be utilized to reach our stakeholders. This will include the company intranet, so every time anyone from Piedmont Healthcare would log into the village, they will immediately see across the banner a display of our goal to increase education around pressure injury prevention in the hospital to keep our patients safe. Staff will be briefed on it at department meetings. Clinical managers will talk about it at their staff meetings. Piedmont Healthcare has twice a day safety huddles at every facility at 10 a.m. and 10 p.m. and this will be discussed at each one of those safety huddles. So night shift is being reached as well as day shift. We also would like to assign surveys to all frontline staff members to take just to gauge their knowledge base prior to the rollout. And then we would like to implement and assign the same survey after the rollout is completed just to evaluate how much they've learned through the process. We also want to talk about it at leadership meetings, both before and after, to increase buy-in from the leadership staff. We also want to talk about wound care nurse rounding on all the units. We would like to have a wound care nurse on every unit at least once a week on day shift and night shift, that nurse is available to ask questions, to gauge feedback, to go to the bedside and see patients with the nursing staff in case they have any questions that can be answered in real time. Rolling in services through the nursing units. We're going to be inviting the vendors to come with us to provide hands-on education with the supplies that we have available to help prevent pressure injuries in our patients. We will also be working to establish safe practice standards for our teams. We want to empower and engage the frontline staff through providing a wound care skills lab where nurses can come down and have checkoffs. We also want to have health stream modules assigned to the nursing staff. And again, the rolling in services with the vendors to provide hands-on support and real-time education. Establishing standards is important. This will enable us to evaluate if the standards are being followed through chart audits by nursing. The implementation to keep our patients safe will improve patient satisfaction by helping to reduce patient harm. Families will notice that we are being more attentive to their loved ones as well. Hospital-acquired pressure ulcers impact the hospital because we have to pay for those. Those cost about $60,000 per pressure ulcer, and that's the base cost. That price can go up and become very costly if we aren't able to prevent those. CMS does not reimburse for hospital-acquired pressure ulcers. Pressure ulcers are also a leading cause of lawsuits being brought against hospitals, and settlements usually are around $250,000. So we plan to utilize a feedback control model to help us monitor the effectiveness of this rollout process. After establishing safe practice standards, we will monitor daily reports for documentation adherence and obtain feedback from our stakeholders in real time. Leaders will conduct patient rounds and use feedback from patients and families as well to evaluate the rollout. At this point, managers will be able to take steps to address any variances they've found through their evaluations of the process. It is important that when established standards are not being followed, that we go back around and see where there were any lapses in the process and take some corrective steps to improve our quality and help us reach our goal. Leaders can go back to the frontline staff, continue to provide ongoing reinforcement as necessary in real time by closely monitoring the data that will be available to us. This will help ensure that the team is kept on track and able to reach our strategic goal of keeping our patients safe through increased awareness and education for the nursing staff for them to prevent hospital-acquired pressure ulcers. Thank you and have a great day.